Hello everyone. I am myself Dr. Rajesh Gubba. I am the general medicine educator. So in this session, I'll be discussing the quiz which I have posted on 9th of May on my Telegram channel, that is Medicine Made Easy by Dr. Rajesh Gubba. So every day I'm posting the quiz on my Telegram channel, and on subsequent day I'm sending you the explanation as well. So as a part of it, let me discuss the first question. Athetoid movements are most marked in the face, trunk, proximal part of the extremities, distal part of the extremities. So now let me tell you what are athetoid movements and where they are most marked. First and foremost, the athetoid movements are most marked in the distal part of the extremities. And how do you describe these athetoid movements? They are slow, writhing, involuntary movements that affects the hand, feet and as well as face. So if you take this hand and as well as face, they are the distal part of the extremities. And where exactly is the site of lesion for the development of the athetosis? Now let me tell you various involuntary movements and their respective site of lesion. So if you take this athetosis, it is continuous writhing movements within the hand, arm, neck or face, and the site of lesion for the development of athetosis, it is the globus pallidus. Next important involuntary movement is hemibalismus. Hemibalismus, it is a sudden flailing movement of the entire limb, and the site of lesion for the development of hemibalismus, it is the subthalamic nucleus. And for the development of chorea, what is chorea? It is flicking movement in the hands, face and other parts of the body. And where is the lesion for the development of chorea? That is the caudate nucleus and as well as the putamen. So this will be the site of lesion for the development of chorea. And Parkinson's, right? You can remember the mnemonic, that is RAT, rigidity, akinesia and tremors. And the site of lesion for the development of the Parkinson's, it is the substantia nigra. So this is a very important slide to know what are the various involuntary movements and what are the various sites of lesion. Now you see the next question. A 10-year-old male coming with repetitive blinking of eyes, twitching of nose and jerking of neck accompanied by vocalization. What is the most probable diagnosis? Tourette syndrome, tics, cluster tic, myoclonus. So this is a classical description of the Tourette syndrome. Now, what exactly is your Tourette syndrome? Tourette syndrome is that where the individual will have multiple types of tics with vocalization, right? That is what is called as the Tourette syndrome. And how do you treat this? Most of it, like, they will be self-limiting, but if they are severe, then we need to give haloperidol. Now let me give you a detailed explanation of this Tourette syndrome. So if you see this Tourette syndrome, it is a neurological disorder characterized by repetitive involuntary movements and vocalization called as tics. Now where all you can see these involuntary movements. Involuntary movements can involve like eye blinking, facial grimacing, shoulder shrugging, or vocalizations such as grunting, coughing or uttering obscenities. So this is what is the tics of the Tourette syndrome, right, where they are being localized. Now what exactly is the cause is it might be due to environmental factor or a combination of genetic and the environmental factor. And when will this Tourette syndrome start? It usually begins in the childhood and can persist throughout the person's life. Okay, although the severity of the symptoms often decreases as the age of the individual increases. And this particular Tourette syndrome, that is tics, it is more common in boys rather than girls. And if they are severe enough, then you need to give haloperidol. Otherwise, the intensity decreases as the age of the individual increases. So that is about the Tourette syndrome, which is a form of the involuntary movements. Next, sudden, brief, shock-like, jerky movements involving groups of muscles with normal consciousness are called as hemibalismus, myoclonus, athetosis, chorea. So you see, jerky movements, group of muscles, normal consciousness, all these points towards the myoclonus. Okay, so what is the definition of the myoclonus? It is sudden, brief, shock like jerky movements involving group of the muscles with normal consciousness. And how do you treat this myoclonus? The treatment completely depends upon what exactly is the underlying cause. It can be the part of the epilepsy. They can be part of the metabolic disorders, right? And some of them, they are self-limiting. So you need to treat the underlying cause for the myoclonic jerks. So like for example, you take in case of epilepsy, right? We have a form of epilepsy called juvenile myoclonic epilepsy, where there can be myoclonic jerks within the arms. And for the juvenile myoclonic epilepsy, the drug of choice will be valproic acid. So whatever is the underlying cause for that myoclonic jerks, you need to treat accordingly. So that is about the definition of the myoclonic jerks. Next, features of syringomyelia include all of the following except dissociative sensory loss, early sacral involvement, suspended sensory loss, wasting of muscles of the hand. So here the correct answer is, right, means the question asked is except. So except early sacral involvement will be not there. In case of syringomyelia, there will be dissociative sensory loss. What will be the dissociative sensory loss? There will be loss of pain and temperature, right? There will be loss of pain and temperature, whereas the posterior column sensations, they remain intact. Okay, so that is what is syringomyelia, right, where you have the dissociative sensory loss. And sacral involvement, right, early sacral involvement will not be there. In patients with syringomyelia, there will be sacral sparing. And third important is they will have suspended sensory loss. That is what is nothing but your dissociative anesthesia. And there will be also wasting of the small muscles of the hand. And what exactly is the syringomyelia? It is the fluid-filled cavity within the central part of the spinal cord, right? It is the fluid-filled cavity of the central part of the spinal cord. And this syringomyelia, most commonly, it is present within the cervical area, right? Most commonly, it is present within the cervical area. And this fluid-filled cavity, that is syringomyelia, which is present in the central part of the spinal cord, they will damage or they will destroy this spinothalamic tracts, right? They will destroy the spinothalamic tracts which are crossing to the opposite side. But whereas the dorsal columns, they remain intact. And as the severity of the syringomyelia progresses, they can also cause the compression on the corticospinal tract. So there will be loss of spinothalamic tract sensations, but the dorsal column sensations, they remain intact. And because the syringomyelia is more common in the cervical area, the sensory loss will be in the form of the cape-like distribution. That is like a shawl-like distribution, mainly over the shoulders and as well as the arms. And sacrum, right, there will be sacral sparing. Right, if you take the sacrum, there will be sacral sparing. Now, in case of syringomyelia, you have the cavitation of the central part of the spinal cord, and there is damage to your spinothalamic tract and the posterior column sensations. So, dissociative anesthesia means loss of thermal and painful sensation, but light touch, joint position and vibration sense, they remain intact. And what are the complications that you can come across in patients with syringomyelia is, this syringomyelia, it can progress to the brainstem. Once it progresses to the brainstem, we call this as the syringobulbia. And whenever there is syringobulbia, there will be involvement of the lower cranial nerves, that is 9, 10, 12, that can make the individual to land up in respiratory paralysis as well. So that will be the complication of the syringomyelia. And how do you manage this syringomyelia? The investigation of choice will be MRI, and the treatment that you need to do is the surgical decompression. And what exactly is the etiology of the syringomyelia? The etiology is Arnold-Chiari malformation type 1. That is the etiology for the syringomyelia. Now, the next question, if you see, in spinal cord, sacral fibers are placed laterally in all except lateral spinothalamic tract, lateral corticospinal tract, ventral spinothalamic tract, dorsal columns. So, Now, in case of the dorsal columns, if you observe, the sacral fibers, they are located medially, whereas in all other tracts, right, the sacral fibers are located laterally. Now, let me show you an image of this. Now, these are the dorsal columns. You can observe the dorsal columns, the medial fibers, right, the medial fibers are the sacral fibers, the lateral fibers are the cervical fibers. Whereas you take in all other tracts, like for example, this is the pyramidal tract. The red one is the pyramidal tract. You can see the sacral fibers, they are present laterally. And then you see this is the spinothalamic tract. In the spinothalamic tract, you can observe the medial fibers are the cervical fibers and lateral fibers are the sacral fibers. So only in the dorsal column, the sacral fibers are present medially, whereas in all other tracts, the sacral fibers are present laterally. So this is about the discussion of the quiz which I have posted on the 9th of May on my Telegram channel, that is Medicine Made Easy by Dr. Rajesh Gubba. So you can join on my Telegram channel for daily quiz discussion. Thank you very much. See you tomorrow again.